We're transitioning now into zoonotic diseases, and really these are this is the area of One Health that is probably the easiest to explain to the public about why a One Health approach is so important, and especially now that we're smack in the middle of a once-in-a-century pandemic. So we wanted to end our sessions today with zoonotic diseases. We have some really interesting talks coming up, and then following that we'll have a short break, and then we'll have a panel discussion with questions from the audience for our panel. So our first talk in this session is from two speakers, also from the College of Agriculture, Paul Byerly and Stephanie Slinsky, and they'll be speaking about their really fascinating work on wastewater-based epidemiology, which came to fruition in a major way with the COVID-19 pandemic.
All right. Hello, everybody. Thanks for having me back. I was here at the first symposium, and on that one I gave an overview of wastewater COVID surveillance that we were doing down there and how that allowed for public health response. I was pleasantly surprised at that first symposium to find so many sort of different researchers, different projects that could collaborate and utilize that type of facility for research, for public health. And so today, we're back. I thought I'd review a little bit of what waste-based epidemiology is and how it can be used for One Health research. And again, I'm trying to get your minds going of like, how could we use that tool in the research that you're doing? And then my colleague Stephanie Slinsky is going to talk about a case study where we used waste-based epidemiology in a particular situation down there. And she'll also cover future targets, other potentials for expanding the capabilities of our lab and of that methodology. So a quick overview of waste-based epidemiology. It's not new, but COVID-19 brought it to mainstream and to the forefront as a real good tool that allowed early warning and a targeted response from public health. Basically, one of the advantages is you can collect a sample from everybody with a single sample, right? It's not just the people that go in and get tested. It's not just the people that end up in the hospital. It's all of the community that you're sampling. And that could be anything from a huge wastewater treatment plant, hundreds of thousands of people, or it could be as simple as a porta potty that's got a crew of 30 farm laborers using it. So you can define what the community is that you want to monitor. And we were testing for COVID. As Stephanie will get into, there's a lot of different things that you can monitor for. And in this case, at least with COVID, you're looking for the RNA of the SARS-CoV-2 virus, and you get a week or so early warning. So you can actually respond, public health can respond and make a difference and avert outbreaks and things like that. So this slide just kind of shows, you test the sewage water. When you detect the virus, you get this early warning. You can have public health response do targeted response in many ways. They could test at a much smaller scale. They can do testing. They can do public education, whatever it is. But that's how it was utilized. Now, as opposed to community-wide testing, if you get to testing a single building, you all have probably heard about Dr. Ian Pepper's work at the U of A's West Center. And that is absolutely what ours is modeled after. We worked with Ian before he became internationally famous, but we knew what he was doing, and he helped us to set up our lab in Yuma so that we could use it there to, well, I'm going to explain that with the next slide. But I think you all know what Ian did in testing the dormitories and trying to make this a safe place for students to come back to. So what happened in Yuma when we decided to do something similar? The Yuma Center of Excellence is a public-private partnership funded by donations from the ag industry, but it is a university entity. And one of our donors gave a $20,000 donation and said, and this was in the summer of 2020, so before there was vaccines or anything else, he said, and you had the meat packing plants that were having everybody get sick and infect everybody else, and he said, is there a way you can help Yuma County get back to work safely? And this was in the summer, so in the fall is when the vegetable season started and all the farm labor would be coming. And we collaborated with Ian. Thanks to Stephanie's effort, we were able to set up a similar lab there with new equipment at the Yuma Ag Center. And let's see, long story short, we've turned that $20,000 donation into about $3.5 million worth of funding to do both site-based testing and community-wide testing. Department of Health Services being a big funder of that. What else? Yeah, I think I explained that last time, but that went really well. We have a steering committee made up of public health people, the municipal leaders, educators, kind of the whole community trying to figure out. So it was not just sort of the scientific results, but it was how do you interpret them and how do you respond to them? And that was what really made the difference to make it useful in that One Health context. Let's see. So where we're at now, we've continued to get funding for the community testing. We continue to test individual facilities. We have recently hired a research scientist who's going to run the lab and build the research portfolio there. So as, cross our fingers, COVID continues to wane, we're looking at a lot of different targets and other capabilities that the lab can provide. We've just gotten a sequencer so that we can add capabilities there. So basically, to introduce Stephanie, she's going to tell you about a case study where we partnered with DatePack. It's a date processing facility with 200 employees. They wanted to minimize outbreaks, and she's going to detail the process, the results, and then the vision for expansion. And again, I hope it triggers some thoughts in all of you on how your research can be furthered with this kind of testing, especially if you want to do it in Yuma, but it doesn't have to just be in Yuma. We're actually testing for Nogales also. So with that, I think I'll turn it over to Stephanie.
Okay, I'm going to go over some, just the process of what we did to test this facility. This was our first project that we did with our new lab. And what we did was go to the facility and collect a sample from this basin that collects all of the effluent from the facility. And that collects and periodically empties into the sewage system. So we would go in there, collect a sample, and bring it back to the lab. And in the lab, it was filtered and concentrated, and RNA was extracted, and we tested it for the SARS-CoV virus. And we would know by the end of the day if we had a positive sample. So when we did have a positive sample, I would get on the phone with the management at this facility, and we talked through what the response would be. There was several times where we'd get Paul on the phone, and Paul would coordinate with the Center for Border Health to get testing. And when that happened, they would show up with a bus in the parking lot, and they would test all of the employees there. So we had a real great system to react to a positive sample. One of the things we were concerned about early on was that there would be pushback from the workers. But what we realized was this created this environment where the workers felt like they were being protected by their management, and they felt that if they knew one of their coworkers was sick, they felt comfortable saying, hey, you need to stay home, you're sick. And it was helped by policy of this facility that they were paid to stay home. So we were managed through all of this to avert outbreaks in this facility. When the Center for Border Health was not called in, and even when it was called in, there was this talk about enhanced awareness. So, hygiene, wearing your PPE, social distancing. So there was a reminder to the employees about keeping up with all that to help prevent spread. So in this graphic, you can see the lines are the clinical cases in Yuma County. And you can see that the dots are the positive results. And they lined up really well with those peaks in clinical cases. So the first peak was during the Alpha variant. And here you can see that we had a testing event. This was our very first testing event. It was right after Thanksgiving. And there were 4 positive cases. And we had a second positive case a little bit later. There were other events in here where there was testing, but it's possible that the person who was infected just didn't show up to work for the testing because they were ill. So some of these represent times that the testing went on at the facility. The second set of peaks is around the Omicron variant, and this was, so that the Alpha variant, that was a little bit before the vaccines were available. Towards the end, farm workers were getting vaccinated, and that included this group at the date packing facility. The second set of peaks, that was the Omicron, and most people in this facility were vaccinated. We did, however, get 3 more events that the Center for Border Health was called in. There were positives. And there also were several other points where we did get positives, where we either got negatives for our testing or we chose not to test because it could have been when there was a vacation, like the facility was closed, so there was no point in testing. We also, because there was a change in the way people were reacting to COVID because of vaccinations, we changed the way we reacted to the positives. So in some cases, if we got a positive, we would test again the next day, and we might get a negative. And that was just because, maybe people were recovering and they still had some of the virus in their stool, and it was just giving us that positive. So it was interesting for me. I'm not in public health at all. I'm a plant pathologist. Just learning how to react was a real interesting experience, because in the very beginning, a positive was really important because that could mean that you could have an outbreak in the facility. But towards the end of this, with that second peak, it didn't mean the same thing. So we had to reevaluate how we reacted. So with the support of Yuma County and ADHS, we expanded the testing to schools, dormitories, and other municipalities. We started working with Nogales. We've been testing samples from Nogales since March. And this is really important. We can monitor what's moving over the border and track other diseases. There's a possibility for doing this in other places, like meatpacking facilities, or with the farm crews, excuse me. And we want to explore other targets as well, like we're actually doing some West Nile testing, Candida auris, norovirus, adenoviruses, also PFAS or opioids, antibiotic resistance, foodborne illnesses like cyclospora, or also bacterial species that are found in fresh produce. And it's clear that this technology is almost limitless for how we can use it. And I know I'm out of time, sorry. But we have lots of people to acknowledge for this, because we didn't have the in-house capability of doing that. So working with Ian Pepper and his group was really great, and also the people who funded us in the Department of Health.
Thank you. We have time for a question or two.
You talked about
So, sorry, who has a? Unions. Oh, wow. That's, can you repeat it? Yeah.
What I asked was, you mentioned ways that this methodology could be reproduced for other industries, and I was asking to what extent you think unions could be utilized or partners in spreading that on a much bigger scale.
So I hadn't actually thought about that. You're talking about so that workers are more and more protected. One thing is there are some commercial laboratories that are utilizing something very similar and trying to get out there so that it's very wide, so the capability is very widespread. Having the unions be a part of it is a very new, that's a new idea to me, but that could make sense. I mean, like Stephanie said, I was really concerned the first time they did the testing. How are they going to react? What's my employer want to know for? But they were actually really, really appreciative. So I don't know if anybody has any union contacts. It's a tool. It's a tool and could be made available.